Yesterday, I interviewed Dr. Kimberly Prather from San Diego about her work on aerosol transmission of COVID-19. And she introduced me to the Corsi Rosenthal box, which is a homemade air purifier that schools are beginning to implement, put into classrooms down in the US with, she says, great success. Well, some parents and community folks are doing the same thing in Canada, or trying to do the same thing in Canada, but they're meeting a lot of resistance. So I'm going to talk to Amanda Hu from Calgary, who's a community advocate, about her efforts. So welcome to the interview, Amanda.
Thanks, Markham, so much for taking the time and having the opportunity to talk about this.
Well, look, it seems, Dr. Prather is one of the world's leading experts on aerosol transmission of COVID-19. She stands behind the Corsi Rosenthal box. You're trying to build them and get them into schools, but without a lot of luck. What's happening?
Well, we're facing several barriers. I mean, Dr. Prather and many of her colleagues, Dr. Lindsay Marr, other aerosol experts have been pushing for mitigation of aerosol transmission. And so, it's the same story that we've seen with the kind of the hesitancy around respirators being used. It's something that we have to be looking at. And the barriers that a lot of people, particularly in Alberta, Canada, worldwide, and then also with international efforts, are that first, it's the acknowledgement by health officials that COVID is airborne. That's one thing. Then it's secondly, acknowledging what mitigations can be used. So for example, ventilation, so bringing fresh air into your space and diluting whatever aerosols might be in there. Secondly, filtration. So filtering the air that's inside a space and filtering all of the bad stuff out and pushing clean air out, and masking with better masks. These are all simple mitigations to aerosol transmission that we haven't had any traction on. And so, when we're looking at the idea of bringing filters into classrooms, there's a cost associated with it. And so Jim Rosenthal and Rich Corsi, along with other engineers like Neil Comparetto, they had designed this box, and it works. I mean, I'm not a scientist, but I trust the engineers, I trust the scientists behind it. And now we're facing a new issue that we have this accessible option, but they are not being allowed into classrooms.
Right now in Alberta, you're based in Calgary. So in Alberta, the problem appears to be that Chief Medical Officer, Dr. Dina Hinshaw, is reluctant to accept the science behind aerosol transmission. That then her reluctance filters down to school boards, because if she's not authorizing it, the school boards aren't going to authorize it. And therefore the individual schools won't allow these to be installed in the classroom. And so it's fun, the problem starts at the top and flows down to the individual schools. And is that what you're being told in your efforts?
Yes, and I think one of the big things too is that, there are a lot of really conscientious trustees on these school boards who are fighting for mitigations in school. We're fighting for continued testing, tracing, and isolating. And so it's a bit difficult because when they're on the level of trying to fight for those basic mitigations that are even acknowledged and accepted, just because we have a reluctance from our government to continue doing them, there's no opportunity to take a look at what we could be doing even better. And so we are trying to, position the messaging that we can be doing that, and we can also be doing this. And that would actually protect students far and beyond, the basic measures that we're still fighting for.
Here's something that I don't understand, and maybe you have some insight into it. So we've seen Alberta now is in crisis. Its hospitals are full. I mean, they're even looking at flying sick individuals to other provinces. I mean, the system is collapsing, and people are dying needlessly as a result. And children are now becoming infected. We see lists and lists of outbreaks in schools all over Alberta. And it would appear to me that the principle of an abundance of caution should be in play here, right? I mean, you don't just do the minimum, you do over and above whatever, as much as you can in the interest of protecting children and protecting others. And yet that doesn't appear to be, the school districts uh, and also the Alberta Health seem to be wanting to do the bare minimum. What can we, is the bare minimum we can do so that we somehow don't inconvenience those who don't like it or oppose it or whatever. Is that a fair observation based on your experience?
Yes, as someone who has lived in Alberta, who's interacted with this provincial government, who's just tried to survive and keep my family safe, I think that this is a huge problem. And I mean, when you look at the World Health Network, which is the organization that I'm working with for these DIY filters, they have a lot of different initiatives, and they just released a study in partnership with some other researchers that proved that zero COVID mitigations, or the goal for zero COVID, leads to a freer society with fewer economic impacts, with fewer restrictions, fewer need to wear masks. And so it's a complete opposite to what we were told of the balance. And then the hugely damaging messaging of COVID is over, best summer ever. People who were conscientious before, I completely understand the confusion that they have about being told on July 1st, COVID is over, and then being told at the beginning of September that we're in a state of emergency. It's completely confusing if you're not paying attention, and we shouldn't have to pay that much attention to know how to keep people safe.
Final question, Amanda. Do you have any optimism? Are you seeing any cause, anything happening with Dr. Dina Hinshaw, with school districts, with individual schools that would suggest that in the near future, we might see some of these Corsi Rosenthal boxes actually being installed in schools?
Well, I have a lot of optimism from the project in general, because I think it's a way that people who have been sitting at home and they were told to stay home, to get vaccinated, to reduce their contacts, and then things keep getting worse. And so a lot of people have lost hope, and the ability to be able to build something that is validated, it's affordable, it's accessible, and that's something we're working on internationally, is finding accessible versions using materials that are available in different locations. It's something that gives people hope, and it gives people a sense of agency. And so just on that level, I see a lot of hope with this project. Additionally, it's hard because there is a level of desperation here, because we are in such a dire situation, and that desperation has motivated people to find ways to get these boxes into public spaces as much as they can. In terms of the organizational and bureaucratic efforts, we're definitely seeing some movement there. In the UK, we've had a great success with parent advocacy groups reaching out to unions to partner on these efforts, and so it's something that we're doing here, and I'm actually really excited. I see a lot of potential, and there's a lot of hope for me there.
But is anyone from Alberta Health saying, hang on a second, we're going to we'll consider this and get back to you? Is anybody, school districts saying, hey, maybe we need to rethink our policy on this? That's kind of what I'm getting at.
Yeah, I think it's really difficult to hope for any movement from the government, particularly when they're spending so much time with internal issues rather than focusing on what we need to be doing from that perspective. We're having conversations with union leaders, and then I have reached out to school trustees who I know have voiced interest in these units and in aerosol mitigations in general. And so it's kind of a multi-pronged effort. We see a lot of things happening in terms of that we have to get the evidence and the validation and the design and the interest and the enthusiasm happening all at the same time. And I think it's kind of a tipping point that we reach after all of those things come into place, where we'll see more movement. And I mean, just in the sharing of these boxes and these designs on social media locally over the past 24 hours, I've seen huge uptake and increase, because there's been people here who, I've been talking about this for months and months, and, I've been throwing boxes at people and saying, just take one and put it into your space. And so I've seen a lot more interest, even over the past 24 hours. And I do have hope for this. I have concerns that, whatever traction we get on this will be, again, efforts of other bodies who are taking on responsibilities that should be decided by the provincial government, but we can't wait for that.
I'm going to sum up what I just heard, Amanda, which is that down on the ground in the community, at the grassroots, lots of excitement, and people recognize the, how important this could be as a COVID-19 mitigation tool, but you're still not seeing it at the school district and the provincial government. Those roadblocks are still firmly in place.
Yes, I think so. And I think it's, again, going back to the idea that school boards are fighting for bare minimum interventions. And, the idea that we're not even having mandatory masking in grades, kindergarten to grade 3. These are basic things that, it's something where if we spend all of our time fighting for the bare minimum, it really leaves so little space in the conversation for actually doing better. And so that's why we put our hopes on both those efforts, but then also the proliferation through grassroots efforts.
Amanda, thank you very much. Really appreciate this.
Thank you.